There's a belief in dentistry that teeth and fillings simply age over time. There are statistics that show 50% of the work done in the United States in dental offices is the replacement of fillings that have already been done. And this is why there's an average lifespan expectation for a filling. Silver amalgam filling, for example, the expectation is 10 to 15 years if you do a Google search. And for white or composite filling, about half that time, 5 to 7 years. Now, this is an important thing to consider. Say you're 20 years old and you have a cavity that has the potential to perhaps be reversed naturally. Think about it. If you have a composite or white filling done at 20 years old, by the time you're 40, you could have had that filling replaced 3 times. Each time you have a filling replaced, there's the potential to weaken the tooth, which happens, and also irritate the nerve on the inside of the tooth every time you have the filling changed. This is why so many white fillings end up needing root canal treatments at a certain point. And those root canal treatments are necessary when the nerve has died. Once the nerve has died and you've had a root canal, then you're going to need a crown to cover the exposed part of the tooth in the mouth, because root canal treated teeth dehydrate. They get very dry and then they're easily fractured. The problem is that once you have a crown made, it's usually porcelain, and this is a firmer substance than tooth enamel. And say you have a lower tooth with this crown and it's biting against an upper tooth, especially an upper tooth that maybe has a filling also in it, that tooth has more potential to be fractured by biting against this harder substance. So you see, once you get on the road of treatment, there really is all kinds of ramifications along that road. And that is why so many people sort of feel they never get off this ongoing treatment plan. And I'm going to propose that if you take a new approach, if you nurture the good bacteria in your mouth, if you avoid long periods of acidity, and of course I recommend the regular use of xylitol, mint some gum after every meal and in between meals if your mouth is dry, stimulate a flow of alkaline saliva, and try to mineralize your teeth with this saliva, and also with good foods and with the products that you're using to care for your teeth. If you try to strengthen your teeth and mineralize them, you'll find that these fillings don't wear out, they don't age, and you don't need ongoing treatments. So start as soon as you can, and let's all try and live to 100 with the same teeth in our mouth.